You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about new breakthroughs in hair restoration surgery, what you need to know. And with us, we have Dr. DeYarman. Okay, Dr. DeYarman, welcome to the program.
Thank you.
Now, for people, and by the way, for people that don't know you, you're one of the guys that has the most experience in the world when it comes to hair transplant surgery.
That's correct.
About 30 years you've been doing this. This is all you do. Mm-hmm. You also are one of the world record holders, or close to, the most grafts in one head.
Correct.
Is that right? I mean, you do more grafts than most people.
That's right.
Per one head. Okay, good. Now, let's talk a little bit, though, about pricing. And I told you I want this for my internet show because it was very interesting what I learned on the couch. And we're going to see if you'll, because a lot of doctors don't want to tell the truth on my show. Okay? They go, well, they want to be politically correct. But let's talk about Bosley, #1 guy in the world. Is that true?
Yes. He does more transplants, more advertising than anybody in the world.
I mean, in the world. And they have these franchises across the country.
All over the world.
How are you different or better, as you see it, in your opinion?
#1, I do the consultations. They don't.
But why is that important that the doctor?
Well, they're having a salesman do the consultation. So what's the salesman's objective in doing the consultation? To sell you something.
Okay.
As a doctor, your objective is to provide service, to help somebody.
And you're more accountable, by the way, because you can't exaggerate, because when it's done...
Yeah, I'm the one that said this is what you need or this is what you should do. The next thing is that I only do 1 patient a day.
Why is that important?
Well, they might do 3 or 4 in a day. Now, I always tell people, would you like to be the last patient that day if you're number 3 or 4? I mean, can you imagine what the help would be like, what the service would be like? I'll spend an hour just in the design before we even go into surgery. Where Bosley, he's got a lot of clients lined up that day. He can't spend that much time. He'll draw in the hairline really quick, put it in there. A nurse will give the anesthesia. I give my own anesthesia. You know, I remove the tissue. I sew it up. I do the recites. I do the whole thing.
There's a lot of art to this, by the way. There's a lot of art to this.
Absolutely.
And you're 20% less, by the way, than these guys.
Yes.
They're about $5 a graft. You're about $4 a graft.
Exactly.
Okay.
And they usually don't do as many grafts in a session as we do. Because I get this all the time. Well, I went to Bosley, and they told me I needed 1,500 grafts. They come to me, I say, no, you need 2,500. What's going on?
Yeah, what is going on? How do you prove that? Is that just your eye, your opinion? What is it?
The way you prove it is you lay a grid, a 1 centimeter grid over the area that you're going to transplant. Count up the number of square centimeters, take it times 40, and that's the number. That doesn't lie.
So to get the job done correctly,
this is what you need.
So they're underestimating.
Exactly.
Which is giving the appearance of a lower price.
Exactly.
Is that right?
Yeah. Because if you're charging $5 a graft, and you're doing
less grafts.
You less grafts, so the price is still, close to what I'm charging. Well, I'm doing more grafts for less per graft.
But that's what everybody wants, right? I mean, they want the thickest hair possible.
Everybody wants the most. Okay. You want the most you can do. So, and then,
So when you show them this on the consult, that they need 2,000 more grafts than what they were quoted elsewhere, and you show them the proof, what do they say? Are they frustrated with these other people?
Pretty much. But they'll, Bosley's operation runs by a lot of photos, testimonials, TV advertising, and things that, are advertising, marketing driven. What I do is things like this, where I try to...
And this is your opinion, by the way. We should mention this. This is not to bash Bosley.
No, not at all. No, he's in a business.
And I don't want to put words in...
There are doctors at Bosley that do excellent training.
But I don't want to put words in your mouth, but it sounds like that they're giving less grafts than what's necessary, in your opinion, to make a good head of hair. Is that right?
Yeah. I mean, they're telling the patient this is what they need. And I'm telling the patient, if you want to treat this amount of area, this is what you need. Now,
more grafts.
Exactly. Now, maybe their patient is misunderstanding. Maybe he's thinking, well, maybe that was I just told him I wanted the front done, or whatever. But,
okay.
There's a lot of...
What else? What's your other competitive advantage over other guys? Because you're doing 2 other things that are very interesting.
Well, I use PRP and ACell. And those are new treatments. I mean, nobody else is doing that.
As of this taping, and that's what? Platelet-rich plasma.
Right.
Injected for lower downtime.
Right. Better heal.
Okay.
Quicker quicker hair growth, less redness. It's PRP has been around quite a while. It's used routinely in orthopedics.
Plastic surgeons are using it now in the face.
In facelifts. It just speeds up the healing time. And then A-cell, this is a new stuff, and this is what they call extracellular matrix, and it is stimulating cell growth. So it's getting, if you're doing surgery, it's getting the cells to multiply that are in the type of cells that you want to reproduce in an area, not scar tissue.
Okay, so all the time, I mean, you see this happen all the time, where somebody comes in with a price, and they're being what do you call it?
Underestimated.
Underestimated as far as the amount of grafts they need to get the job done right.
Right.
Interesting. So now you're presenting at the next hair meeting, right?
Correct.
Tell me about that.
Well, I'm going to talk on A-cell and PRP. In the past, you try to present at every meeting because you're trying to share your experience. I used to present a lot on the use of Photoshop. And I had one person say to me one time, "Boy, you know a lot about computers." And I said, "Only use 3 keys." But they're so overwhelmed with it,
Okay.
Well, PRP and A-cell, I'm going to present how I use it. I'm going to show the benefits.
And this is the stuff you inject in the head for better healing, better downtime. More hairs may even take. Is that correct?
Well, it appears
Possibly?
that way. It appears that way.
Okay. You just can't prove it yet.
Exactly.
Can't they photograph it and prove it?
Well, that's what you do. But photographs are so subjective, How do you know?
How do you count the hairs?
Exactly. Yeah. So you got to just look at it and compare, and you try to formulate an opinion.
Okay. Now we want people to learn something today. Okay. So if you're going to consider hair transplant surgery, most of these centers you go, you're dealing with a salesman, like a timeshare or whatever. I'm just saying. I'm calling him a salesperson. Nothing against salespeople, but in your office, and there's a lot of surgeons doing this, you should be meeting with the doctor.
Exactly.
For a real evaluation.
Exactly.
And that'll give you the as far as pricing, a more accurate price.
Exactly. And get, I think, the service you're looking for.
Okay.
Can you imagine going to a doctor's office for any other illness and meeting a salesperson? This doesn't make sense.
Okay.
Come on,
well, when you put it that way, right.
Yeah,
okay.
I mean, this is a surgery. This has got a very important outcome. You really got to understand what this is all about.
But you could only do one a day. So some guys would argue that's not a very good business model, this Dr. DeYarman. I mean, it's a better result, but it's not a great business model.
Well,
right? Could they argue about that? Could they say that?
If you're at the meetings, for the business, then you should, set up a Bosley model.
Okay.
But if you're
because behind your back, they're going, "Oh my God, this guy is a graft fanatic. He's got them there 5, 6, 7 hours."
Yeah, I don't know what they're thinking. I really don't. I mean, I know the guys that work there, and they do very good work. But I think they're under a different,
philosophy.
Yeah, I mean, theirs is after the bottom line.
What is your philosophy about hair, by the way? If somebody had to say, "Dr. DeYarman, what's your goal with a patient?"
I think the goal is to, give them back their hair, and that nobody knows that it was a hair transplant.
Okay.
That it's their own natural hair growth.
Okay, so they could Skype your consult. They could do a consult virtually, where you look at their head. Is that right?
Yes.
And you quote them a price and everything?
Well, what they do, they go online. They fill out a form. And then there's specific photos I ask them to try to get me.
Okay.
And then I answer these. And then the idea is that...
Oh, so you're not talking video chat kind of thing?
No.
Oh, I see. That's what I thought.
No.
I see. Okay. But that might be the future.
Yeah. It'd be pretty hard to do.
Pretty hard. Okay, I want to thank you so much for coming.
All right. Thank you, sir.
Very interesting.
All right.
I'm Randy Alvarez. We'll see you next week.